Good morning, all. I, Dr. Anagha Agarwal, am working as a reader in Department of Public Health Dentistry in NPDCS Visnagar, that is Narsimai Patel Dental College and Hospital, Visnagar. Today, I'll be taking a lecture on experimental epidemiology for you. So I'll be discussing my lecture under following heading, that is epidemiological methods. In short, I'll be taking about descriptive study and analytical study, and in long or in details, I'll be explaining you what are the experimental studies, what are the different uses of these studies, and what is the association and causation. And finally, conclusion of this entire lecture. So to start with, what is epidemiology basically is epi means upon, demi means people, and logy means study. So epidemiology in together we call it as the study which is done on the people. In short, it is the study which is done on the people to understand the basic nature of the people, the basic habitation of the people, and what are the risk factors or the disease factor in the people. So the definition which you need to learn and mug up is the study of distribution and determinants of health-related states or events in specified population and the application of this study to the control of health problems given by John M. Lass in 1988. Now, what does this definition mean? It says that it is the study. So, epidemiology, since it has a logy in it, it's a study of a distribution and determinants of health related states or events. So, what do you mean by this? Distribution means how much is particular disease or a risk factor which is there inside a population. So, whether this population has high prevalence or low prevalence of any particular disease, how much is the frequency of people falling ill for such particular, is there any pattern? Is there any specific rate with which people are falling ill? And then second is determinants. That means what are the risk factor for this particular disease for that particular population? And all these distribution and determinants should be related to any health related states or event which is happening in that particular population and a specified population which we are taking into consideration and the application of this study to control of health problems. So finally, when we know this is the particular risk factor which is giving rise to so much amount of disease, we can always prevent or stop that disease from happening so that this will have an application of the study to control that very health problem in that particular population. So this is the meaning of this definition. So basically, what are the principles of your epidemiological studies? First is exact observation, which should be strict, vigorous, accurate, and precise. So, the observation that you make out of your study should be very strict, whatever accurate, vigorous, and precise. So, you should know what you're looking for. You should have that operational definition into your mind, and ultimately, you should see that disease. Correct interpretation, which should be free from error. So whatever you observe in that population, you need to interpret with the help of that observation what exactly is the amount of disease and why you are saying that, how much is the disease and whether that disease is in more amount or less amount from the general population. Then rational explanation, intelligent, sensible, and reasonable explanation of that particular phenomenon. So once you know what is the disease, what are the risk factor, you should have a rational explanation for saying that this is a particular risk factor which is present in that population and ultimately that is causing that particular disease. Okay, to say this, you should know, you should have a strong scientific backing. So you should have a scientific construction by expert knowledge and technical skills so that ultimately you can back up your hypothesis, whatever you want to say about that population or about that disease, and that should be technically sound. So, what are the various epidemiological methods generally being used? First is observational study, and the another type is experimental study. So, what do you mean by observational studies? Basically, observational study means you just have to observe the very basic study. So, whatever you're going to, whenever you're going to a population, you just have to observe. You do not have to intervene. You just have to see what is there into the population. You're not gonna intervene, you're not gonna give them any instruction, you're not gonna take off anything from their life, and you just have to observe whatever they're doing in their day-to-day life. That's a observational study. So observational studies can be divided into descriptive study as well as analytical study. Now, what do you mean by descriptive study? Here we just describe the population. Just describe the population. So we just describe how many people are living there, what is the male is to female ratio, what is this, how many are like infants there, how many are, how much is the dependent population, what is the SES status of that population, educational status of the population, what is their attitude towards any new treatment or a dental treatment, and how do they perceive health. So just description of that particular phenomenon which you're studying in that particular population. Second is analytical study. Once the descriptive study is done, you will have some hypothesis. So descriptive studies are also known as hypothesis making studies. So once you have the observation, with the help of your scientific knowledge and interpretation, you can come to a hypothesis saying that this particular risk factor which I'm finding in this particular population may be the reason of that particular disease, high amount of that disease in that particular population. So that is hypothesis making study, whereas analytical study and experimental studies are known as hypothesis testing study. So once you have the hypothesis, with the help of descriptive study and analytical study, you actually test that hypothesis. Whatever assumption or presumption you've made, whether it is right or wrong. So in analytical study, since again it's a type of observational study, you need not have to intervene. Whatever you have been served, whatever you have been seen, you have to just see it from the outside. Just have to see it from the outside. Take some interview, talk to the people, take their diagnostic test or take their indices, but you need not have to intervene. You need not have to give something from your side or remove something from their life to come to a conclusion. So, and the types of analytical study are ecological correlational study, cross-sectional prevalence study, case control or case reference study, cohort or follow-up study. Now, the second time, which is the most important, which we are going to take today, is a experimental study. Now, what do you mean by experimental study? Here we are actually going to have an experiment. Actually going to have an experiment. We're actually intervening in their day-to-day life. We are putting something as a doctor, we are advising them something, or we are asking them to remove something, some bad habit from their life, so that the risk factor will be removed and their life will be better. There will be health promotional activity. So this can be again divided into randomized control trial or clinical trials and non-randomized control trial. Randomized control trial is the best study that we can do with minimized error, whereas non-randomized control trials are not as good as randomized control trial, but we have to do it, but every time we cannot have randomization. Then another one is field trial or the community intervention trial, which is done in fields for the community intervention, and general community trials where we can find out some very specific thing about the community. So one by one we will be going now. So what is research study or the interventional study? Are the studies carried out under direct control of the examiner. So actually the examiner have control over some things which are planned for those participants. That's why these are known as experimental studies. Now, what are the aims of these experimental studies are to prove scientific proof of etiological factor, means whatever we were thought thinking, or whatever assumptions we were having in hypothesis, we need to have a scientific proof saying that if I'm giving this particular drug to this person, I'm not giving this particular drug to this person, how his body reacts, that we have actually experimented on that person and finding a proof for it, right? To provide a method of measuring the effectiveness and efficiency of the health services. So if you have planned a health service, you need to know how well it is going, or do you need to do some modifications for its working. So for that, what we do is we do some randomized control trial in between to find out the effectiveness and the efficiency of the health services. So there are types of experimental studies. Those are the animal experiments and the human experiment. So anything new, we cannot just give it to human, but we have to test it in animals to find out whether it is lethal or not, right? So there are animal experiments, the animal studies. The animal studies have contributed to our knowledge from far, like whatever new we want to test, we test that in animals and then we actually put into the human beings. So, what are the advantages of doing these studies first in animal then in human? Are experimental animals can be bred in laboratories and manipulated easily according to the wishes of the investigator. It is difficult to handle humans as compared to animals, right? So, in a small setup, you can have small animals and you can actually work with them. They multiply rapidly and enable the investigator to carry out certain experiments or genetic experiments which in human population would take several years and involve many generations. So if generational study you wanted to do, it's not possible for one human to stand there and to do generational studies. Whereas for animals, they multiply rapidly. So we can see some genetic studies in animals itself. There are advantages of animal studies definitely, but there are some disadvantages too. So what are the limitations or disadvantages of animal studies is not all human diseases can be produced in animals. So since we are genetically different, not all the things that we see in animal can be immediately seen into the human. All the conclusions derived from animal experiments may not be strictly applicable to human beings. Again, because of the different genetic setup, different rehabilitation, and different immunity, all the experiments that you conduct on animals may not have same results into human beings. So we have to be cautious about it. Okay. This highlights the difficulties encountered in extrapolating findings from animal experiments to man. That's why we have to do some human experiments. Okay. So these studies are the more essential in investigation of disease that cannot be reproduced in animals. Some diseases we cannot reproduce in animals, or otherwise we cannot extrapolate those findings to the human being. So we need actually volunteers to participate in these studies. Human beings have participated in studies of malaria, syphilis, hepatitis, measles, polio, and others, which are life-threatening diseases. These experiments have played decisive roles in investigating disease etiology and in testing preventive and therapeutic measures. So, we need more and more human experiments, okay? Ethical and logistic consideration often prevents its application to the study of disease in humans. So, ethically, you cannot actually harm somebody to have some results. So, you have to be very cautious when you're planning a human experimental study. Therefore, before launching human experiments, the benefits of the experiment have to be weighed against whatever is problem with that study, and ultimately then you have to take decision accordingly. The volunteer should be made fully aware of all possible consequences of the experiment. Before enrolling, you have to tell the volunteers about everything about your study, what you're going to do, what you're not going to do, what may be the results of these studies, and what may be the positive problems or consequences or side effects of this study on their health. If voluntarily still they want to participate into your study, then only you can take them into your study. Hence, the WHO in 1980 had laid down a strict code of practice in connection with human trials. So, uh, types of basically, so what are these types of these experimental studies? There are two types of experimental studies. First is randomized control trial. That means where the randomization can be done most ethical and most unbiased study, and then the non-randomized or non-experimental trials. Now, randomized control trial where those involving a process of random allocation. That means every person has equal chances to be selected as either case or control. Whereas non-randomized or non-experimental trials, they do not have this randomization process where they can lead to a bias. Those departing from strict randomization for practical purposes, but in such a manner that non-randomization does not seriously affect the theoretical basis of conclusion. Okay, so these are some steps of RCT or the randomized control trial. First, we need to prepare a protocol. So we need to write down whatever we have to do on a piece of a paper, and we have to understand the methodology that we want to do on a patient, how we're gonna assess our ethical problems, and whom we're gonna introduce to our into our study as a participants. All we have to think about and write it down on a paper in a specific manner. That is called as protocol writing. Then selection of reference and experimental population, that means the sample size, then randomization of this sample into either case or the control group, then intervention, that means whatever we have thought of them, what we are going to give a new drug to a case group or to controls, that we have to decide and do, and finally to do follow an assessment of the outcome of the analysis. And we'll go by one. What's this preparing a protocol? Protocol is a blueprint of the study which we have to write on a piece of paper, as I've already told you. It's a strict protocol having aims and objective, questions to be answered, criteria of selection like study and control groups. So what are your inclusion criteria, exclusion criteria for a particular population? Intervention to be applied, which intervention you're thinking of, which is your gold standard intervention with which you're going to compare. Standardization of the working procedure as well as the working instruments, and schedule for the entire experiment that has to be written into protocol. And this protocol has to be subjected to ethical review, so that if there are any ethical glitches, that can be sorted out. Once that is done, once your methodology is finalized, then we'll go for the reference population and experimental population. So what is a reference population basically? Reference population means the entire population you want your results to give to, or to extrapolate for the entire population. But because of, and you want to do actually that experiment on the entire population, say for our nation, if you want to do any experiment on India wise basis, but it is practically impossible to do or to study such a big population because of the less amount of manpower, the money, the time, everything is constrained. So we need to do it on a experimental population or a sample that we say it. We should remove some number of people that can be determined statistically, that is called a sample size. So we need to remove those many people from that entire population, choose some people randomly from that population and actually work on the small group of people. Okay, so this is called as experimental populations. Whatever results we're getting out of this experimental population should be extrapolated or statistically multiplied, so that it can be extrapolated for the entire reference population. Now, this whatever sample population we're taking should be exactly similar to your reference population. Exactly similar to your reference population. What does this mean is, if your reference population consisting of elderly people of low socioeconomic status and all males, your experimental population should also have all the elderly people with low socioeconomic status and male. Okay, so it should be exactly similar. The participants or the volunteers must fulfill the following three criteria. Must give an informed consent. So what is the informed consent? It's a nature of the consent should content, nature of the treatment, that means what you're going to do to that participant. Alternative care, that means whether this care is better or that care is better, so they can choose between the care. Benefits of this new drug, then risk of this new drug, and if any question from the participant regarding that particular study. So this all should be mentioned in this informed consent, and if the volunteer is ready to sign it, then only that participant can enter into your study. Should be representative of the population to which they belong, that is reference population, and should be qualified or eligible for that particular trial. So what is randomization now? Randomization is statistical procedure by which the participants are allocated into groups usually called as study or control group. So randomly you have to take those samples, and randomly you have to give them some group, either case or a control group. This is done to eliminate bias, allows for comparison, and randomization is basically the heart of the control trials. If there is no randomization, the study is said to be erroneous and we do not accept that study. So it is very important to have a randomization in any control trial. Okay, so once randomization is done, we do manipulation or intervention in this. Then the study group will be intervened or manipulated by a deliberate application or withdrawal or reduction of suspected causal factor. For example, if we are doing a study on oral hygiene, if we're doing scaling for the people who are in case group or control group, that means we're manipulating, we're removing those risk factor out of their mouth. So that is a manipulation that we do, and this can be therapeutic or preventive depending upon the study that you're doing. Once that is done, once you've given some intervention, you've given some time to use those intervention, we have to follow them up over a period of time according to the study type. The period of follow-up is predetermined and documented in the protocol already. Both the groups are given intervention as per the protocol for this period, and afterwards outcomes are assessed according to indices or investigations or questionnaire, whatever you want to do. The duration of the trial is usually based on the expectation that the significant difference or mortality will be demonstrable at a given point in time after the start of the trial. So scientific backing has to be there, saying that after this period, this drug may show some visible changes which are which will have interest in that particular disease. Okay, so finally the analysis. So analysis is done by using statistical tests to confirm causative association between cause and effect. So when there are various statistical tests according to your study groups, you can apply them and find out the association between the risk factor and the disease. There may be positive results or negative results. Both are equally important, because positive results say yes, there is a positive association between a risk factor and disease, so that eliminating this risk factor may reduce some amount of disease, whereas negative risk factor will say that this is not a particular risk factor for this disease and we have to find out from some other reason for this disease. So both hold equal importance. Now, what are the bias? Bias are basically systematic error that happen into your study because of which your study is not reliable. So there are different kinds of bias for different studies. For randomized control trial, first bias is participant bias. That means they may subjectively feel better if they and report improvement if they knew they are receiving a new treatment. So psychologically they feel better and they just say yes, I'm feeling better, even if physiologically they're not feeling better. Then second is observer's bias, that influenced if he knows beforehand the particular procedure or therapy to which the patient has been subjected to. That means if the investigator is biased towards his own a new technique which he devised, what he'll think, if I'll get a positive result for my own technique, it will be beneficial for me. So observer will give inadvertently will give positive results for his own technique. Then evaluation. The investigator may give subconsciously give a favorable report or outcome for the trial because he wanted that trial to be succeeded. And to reduce these biases, blinding is adopted. So what do you mean by blinding? Blinding means not telling anybody who's there in which group. So there are three types of blinding, which is single blinding. The trial is so planned that participants are not aware whether they belong to study group or control group. That means only the subjects, they do not know where they belong. Then second is double blind trial, where the subjects as well as the doctor, they do not know where they belong. And third is a triple blind, where the subject, the investigator, as well as the statistical analyst, they do not know where they're been planned. So triple blinding is ideal procedure basically, but we actually go for double blind in most of our trials. Now, there are different types of RCTs, that is concurrent parallel study design, crossover types design, factorial clinical trials, withdrawal study, group allocation study, hybrid study, and double dummy study. We'll be seeing some of them. First is your concurrent parallel design. In this situation, comparisons are made between two randomly assigned groups, one group exposed to a specific treatment and other group not at all exposed to any of the treatment. Patient remain in a study or a control group for the duration of the entire investigation. They are not switched. They are there. Control will be called as control till the end of the study, whereas cases will be called as cases till the end of the study. Now, another one is crossover trial. What does that mean? In this design, the group that was getting new medicine after some time period starts getting standard medicine, and on contrary, the group receiving standard medicine after some time will get the new medicine. In between, both the groups are taken off their medication to allow for the elimination of the medication from the body. That is called as cooling down period. Okay, cooling down period. So advantage of using this study design is it doubly proves the hypothesis, eliminates effects of confounding since each one is acting as their own controls, increases statistical precision, and it eliminates intersubject variability. But uh, even if this is the best design, still it cannot be used in if the drug cures the disease. If there is no disease, you cannot have a crossover. If the drug is efficient at certain stages of the disease only, and the disease changes radically during the period of time required for this study. So there are various types of RCT like clinical trials, preventive trials, risk factor trials, suggestion experiments, etiological health trials, evaluation of the health services, community intervention trials. So most important are the clinical trials. We'll be talking about it. So purpose of clinical trial is prophylactic trials, like if you need to find out some new vaccination. For example, we've done some clinical trials to find out the vaccination for coronavirus, therapeutic trials to try out some new drugs or surgeries, and safety trials to find out side effects of newer drugs. So risk factor trials are proving the etiology of the disease by inducing it with the agent in animal or withdrawing the agent for suggestion. So these are the four purposes of clinical trials. Many ethical, administrative, and technical problems are involved in to conduct a clinical trial. Since you do not know the future of that drug, what you're gonna do or what is gonna happen. So there are many ethical issues. There are phases of clinical trial like phase 0, exploratory, first in human trial, human microdosing studies, designed to speed up the development of the treatment modality to find out whether the drug is behaving in the same way it behaved in a preclinical studies, whether that has been in a lab or that has been in the animals. Administration of a single subtherapeutic dose, a very small dose of a study drug to small number of subjects to gather preliminary data on pharmacodynamics and pharmacokinetics. Means whatever the drug is doing to our body and whatever our body is doing to that drug. Just to find out that very small dose is inserted into a human being. Phase 1 trials, a small group 20 to 100 healthy volunteers are taken. Healthy volunteers. So there are no diseased people here. To assess safety, tolerability, pharmacokinetics, and pharmacodynamics, as well as the dose of the particular drug. Fraction of anticipated doses administered, monitored for its effect on body functions, and to find out the best or the safest dose the study or the phase 1 is done. Highest dose can be administered to find out all these things. Short duration, that is just 1 to 2 months this phase goes on for, and inconvenience fees are paid to the volunteers if there is some inconvenience because of this particular study. Now phase 3. Now, phase 3, where you have once the effect of the drug has been already seen and some amount of dose you've already learned about, there will be effect of the drug on a larger population, that is 100 to 300 people, and dose response relationship is assessed. Some trials combine phase 1, 2, and 3. Phase 3, where randomized controlled multicenter trials are done. So this was done in a small group of people. Now phase 3, you actually generalize the study and multicenter trials are done. Large patient groups like 300 to 3000 patients are assessed. Comparison with a current gold standard treatment can be done and provides data for regulatory submission approval to market. Adverse effects are recalled immediately from the market. If there are some adverse effect that you know, that you come to know after this trial, the drug is recalled from the market. Phase 4 trial, when actually the drugs come into the market. This is a post-marketing surveillance trial. Interaction with other drugs are studied on certain population group and rare or long-term side effects are studied. Phase 5, that is the last phase when we actually give this drug to all people and find out long-term side effects. So comparative effective research, community-based research are done and integration of a new clinical treatment into widespread public health practice. So the drug has been considered as a drug for that particular disease and can be distributed over the counter. So what are the advantages of clinical trials is to produce strongest evidence. RCT can be the only possible research design for some research questions. Experiments can sometimes produce faster and cheaper answers to the research question than observational studies, and they're having good safety as relatively few individuals are exposed to the unpredicted risk in untried interventions. There are some disadvantages too, like experiments are often costly in time and money. There are some ethical barriers to do such kind of a study. Standardized intervention may be different from the common practice, which may reduce generalizability of this result. Experiments tend to restrict the scope and narrow the research question, and large number of subjects are needed for such kind of a study. So we have seen now randomized control trial. The second type is non-randomized control trial, which can be again divided into uncontrolled trial, nature experiments, and before and after studies. Now, what do you mean by uncontrolled trials? An uncontrolled trial may be useful initially in evaluating whether a specific therapy appears to have any value in a particular disease to determine an appropriate dose and to investigate adverse reaction. So we cannot actually control those trials. Those things are actually happening in nature, and we are unable to take control over them. So we have to just see and we interpret accordingly. Then the nature's experiment, where the experimental study is not possible in human being, the researchers seek to identify natural circumstances that may make an experiment. So for some disaster studies, we actually cannot make any disasters to study that, right? So whatever disasters that have been happen in the nature, we have to take their references and we have to come to an inference. Then there will be some before and after studies. These studies may be with or without controls. Here, researchers uses the data available before implementation of the preventive measures in the community, and then he compare the rate before and after the implementation of that particular study. So non-randomized trials are also known as quasi-experiment, not always possible for ethical, administrative, and other reasons. Direct experiments are not possible. Some preventive measures can be applied only in groups or community-wide basis. And disease frequency is low and natural history is long. Crude approach and there is no randomization. So results of these studies are slightly biased. So to conclude, epidemiology deals with the study of distribution and determinants if the causative factor of the disease. For this, it focuses on measurements of mortality, morbidity, disability, and so on. Thank you, my students.